Now, I've treated some difficult patients in some difficult locations, but this might just top all of those. The open ocean and a shark. But today could be life-saving.
Chris is in the Sydney suburb of Manly. He's meeting up with Dr. Rob Jones and a team of specialist divers from Sea Life Sanctuary.
All right, so we're just about ready to go.
They're about to attempt a groundbreaking grey nurse shark rescue mission.
Rob? Chris, how are you?
Good to see you. Obviously didn't get the memo about the dress code.
No, but this is how we dress to save sharks, basically.
No, this could be quite the day.
Oh, look, really hopeful. Like, this could be just wonderful. I mean, these sharks are critically endangered. We know there's one out there with a hook in it. Yep. We've just got to get out there, hope we can find it, get it up, get the hooks out.
Not going to be easy, though.
Not going to be easy, but...
I've got my gear, you got yours?
We're good to go.
Let's get out there.
OK.
The aim of today's unusual rescue is to try and save a young female shark, which could be in serious trouble.
These sharks are classified as being critically endangered. There's only around 1,500 maximum along the east coast of Australia. These sharks are quite young in this colony where we're going into today, so they're essentially the future of the entire species.
Recreational divers spotted the distressed shark entangled in fishing line and with a hook in its mouth at Magic Point, a few hundred metres offshore.
I imagine these hooks, if they've been in there for a while, they're not going to be easy to get out.
No, some of them are pretty deeply embedded, and whether we'll be able to get the whole hook out or not, or just actually cut it off at the base of the jaw, we'll just have to wait and see.
Yeah, but we're on the clock, aren't we, once that shark comes out?
Once that shark hits the deck, 10 minutes is about the ceiling. I really don't like keeping them up for any longer than that.
Okay. But I guess the biggest challenge initially is first of all finding the shark.
Yep.
And then actually catching it, really.
Yeah, they're down in 16, 17 metres of water, so it's a pretty big task.
It will be a risky operation to try to save this injured and critically endangered grey nurse shark.
What we're trying to attempt today is essentially a world-first technique. I mean, we're going into a shark's habitat, trying to corral it, catch it, bring it to the surface and remove something that could ultimately threaten its life. So it's ambitious, it's risky, but we've got a good team today, so we're every chance.
What's happened here?
We just had this little guy brought in.
Wow, okay.
His mum was found on the side of the road.
Oh, no.
The police found him in the pouch, so they've just brought him in to have a check.
A newborn swamp wallaby has been rushed into the Bondi Referral Hospital SASH after a car killed his mother.
Geez, he's strong, isn't he?
Yeah. He's
Wow,
very
but
young,
he's
though.
very, very young. All right.
So little.
So little.
Yeah.
These are tiny neonatal animals and they are very fragile and they'll die fairly quickly. So the most critical things are to keep him warm, check him out for internal injuries or any structural injuries, and then get some nutrition into him. We just see if everything's working all right inside. His heart sounds good. He's got no blood around his mouth or his nostrils. He's nice pink colour, his gums are nice and pink. His legs are good. His tail looks pretty strong. His abdomen feels all right. He doesn't have any obvious bruising or anything.
Yeah.
Everything checks out pretty well.
Seems like a bit of a fighter.
He is. He's been very lucky, to be fair, because he could have been damaged in the road accident. He could have been there for a day or more and suffered from malnutrition and dehydration. And so, thankfully, he's in a fairly stable condition, so we can now transfer him to a carer who can feed him, keep him warm, and hopefully give him the start in life that has been taken away from him. Now we'd need to make sure he does not get cold because he has no hair on him. So let's get him into a heat warmer and he can get some nutrition, all right?
Yep.
We're in the middle of Sydney. We don't get a lot of joeys, but it's nice to see in the city that we still have this sort of wildlife around. And it's exciting and hopefully we can get a good result.
Oh, look at you. You're going to be such a big boy when you grow up. OK, Mr. Joey, let's pop you in your bed. This can be your pouch that you will now live in. Good boy. All right, Mr. Joey, I'll get you some food organised now. You have a little sleep.
All right, this is the spot. It's called Magic Point. Time to get the weddy on and get under there.
On Sydney Harbour, Chris is gearing up for an important rescue mission with a specialist team of divers. They're about to try to capture a critically endangered grey nurse shark, which has been spotted entangled in fishing wire and with a hook in its mouth.
There are a couple of really important stages in this whole process. First of all, I'm going to go down with the other team and try to find the shark that has the hook. The capture team is going to move in with what is essentially a large sock. On the base of the sock, there's a stretcher. If they can herd her into the sock, then they'll close it over the top of her and bring it to the surface.
It's all systems go now, Chris.
It is.
Get down and bring up that shark.
In order to help this shark, first of all, we have to find her. So I'm heading down into the cave where she normally resides, and hopefully we'll spot her there.
But as soon as they get to the cave, there's a problem.
You look in there, and there are 6 sharks looking back at you. And these sharks are all of a pretty similar size, so we have to try to find the shark that has the hook. It's going to be tricky.
While Chris and the team are trying to find their patient, on deck, Rob is making sure everything is prepared for the shark's arrival.
We really want to try and have the sharks on the deck for probably under 10 minutes. So we do want to move and work pretty quickly. The sooner we can get it back into its own environment, the better.
The team is struggling to find the injured shark when suddenly one of the divers spots fishing line coming out of a shark's gills.
Now that we have a confirmed sighting, the capture team is now going to move in and bring it to the surface.
They have to work fast while ensuring their patient doesn't become stressed.
It'll be showtime. Fire up this oxygen. Yep. Okay.
With the shark now on the surface, the pressure to find the hook is on, but it won't be easy.
This shark is a female. She's more than 1.5 metres long. She's at that age now where she's setting herself up for hopefully a long breeding future. But this fishing hook and this fishing line could prevent all of that.
Chris, you want to grab that pole? Just see.
I'm all too aware of the fact that we're on a strict time limit here. We only have 10 minutes with this shark out of the water. We've got to get moving.
The team can already see the fishing wire coming out of the gills. Now they have to find the hook.
Yeah, I can see some lines. Some line at the base of that tongue there. It's looking pretty deep, isn't it? Yeah. So the hook's gone in.
Yeah.
It's swallowed it down so far.
Yeah.
But the hook has actually gone into its digestive system.
Yeah, it'll be down in the esophagus.
Okay.
Yeah. Well, we can't get the hook out. It's too far down.
Yep.
And we don't have endoscope or anything like that. So we're just going to have to accept that's what it is.
Yep.
Hope it's one of those hooks that will rust out.
Okay. Whilst we'd obviously love to be going inside her and removing that hook, it would only put her life in more danger. So really, we have to cut the line at the level of the gills and give her some antibiotics and multivitamins. With some time, that hook should corrode and actually pass through a system quite naturally. Right, needle coming out.
Right. Beautiful.
Coming up 8 minutes, Rob.
Thanks, Dave.
For this shark, really, we've done what we can. And given her body condition isn't too bad at the moment, she's a really good chance of mounting a really strong recovery. Now it's time to get back in the water.
Okay. Up and out. She's out of the water, so we need to move fast.
After all the mayhem of the last 9 minutes, she actually goes into the water quite gracefully. She's just gently caressed into the water and then swims off.
She's off. Very strong.
Yeah. And we managed to buy her some time.
She's going to have a much better chance now than she did half an hour ago.
Exactly.
No question at all.
Yeah.
Look, we're happy because this shark has now got a chance that it wouldn't have had before we did this today, and the whole procedure's gone smoothly. Everyone that we can get up, de-hook, has the potential to be a future breeding adult in this population. So pretty happy with the way it's gone.
Mr. Joey, oh, you're sleeping. You look so cute.
At SASH, little orphan Joey is getting plenty of attention. But now he's well enough to be handed over to a specialist carer from the rescue group Wires.
Raising these little joeys is hard work. They're like tiny little infants. like baby humans, baby horses, baby Joey, kangaroos. They all take round-the-clock care, so they're a lot of work, and you need to be very dedicated and experienced to do it. Come on in, Maureen. Let me introduce you to little Joey.
Oh, wow.
So he's been christened. He's pretty feisty, Maureen, and he looks pretty well as far as I can work out. He just needs some good nursing care, I think, and obviously being how young he is, I think he's going to be a handful for you.
Yep. Yeah, he's very lucky that he was found. Not many people will stop for dead animals, and they don't stop and check pouches either.
There you go, little mite, you get in there. Got a new mum now. Maureen's going to take care of you. That's great.
The little orphan will be fed 6 times a day and eventually, when he's strong enough, be released back into the wild.
And that's what the ultimate aim is, to get Joey healthy enough that he can look after himself, fend for himself, and be released hopefully into a national park somewhere close by to what his territory was originally, or his mother's territory was. That's the critical thing.
Okay.
All right, Joey, good luck, little mate.
Thanks, Steve.
Hope all goes well.
Okay.
Good luck, Maureen.
Bye-bye. Okay, we'll settle you in and we'll get you home and give you a feed. I love caring for Joey's. It's very satisfying. The next step is I'll take him home, keep him warm, and then feed him 24/7 till he's ready to be released.
Wouldn't do that, Cricket.
In Bondi, 5-month-old Cricket has well and truly settled in to her new life with Chris.
There's definitely something going on.
Cricket is obviously the kitten that I adopted a few months ago after she was found in a park, in a box.
Good Samaritans brought the little orphan into the clinic.
See, she's not very happy putting that left front leg down.
And X-rays revealed the tiny battler had a badly broken leg and needed urgent surgery.
All right, I'm done there.
She's had quite an interesting few months with me. She's understood the meaning of destroying furniture, keeping me up late at night, waking me up early in the morning. But now there is a new twist in the story of Cricket.
I feared this day would come, but I didn't think it would happen this early. She's only just turned 5 months old, and this purring, and this calling, and this bum in the air thing can only mean one thing's going on.
Cricket is on heat. And Chris isn't the only male to notice Cricket's change in behaviour.
Exactly how many guys have you invited around? This is kind of every dad's worst nightmare. Their little girl has grown up and there are hundreds of men hoping to get their little mitts on her. Oh, you're looking outside, are you? Yeah, you know why? Because you attracted him. She's in season and she's not scared to let people know about it. I'm obviously a big believer in desexing cats. The last thing we need are more unwanted kittens. I'm just surprised she's come on heat this quickly. There's only one thing to do. She's coming to work with me tomorrow and we're going to sort this whole thing out. This girl has grown up just a little bit too quickly. Tomorrow you're coming with me. And he's going to be disappointed. Cool. Don't get in the way of a young girl and her plans. Remember this place?
Next day, Cricket has the first appointment booked in at the Bondi Clinic.
Oh, hello. It's Cricket.
Today is the very necessary next step in the saga of Cricket. Clearly, when she's on heat, we need to do something about it because when bad girls stay bad, eventually their past catches up with them.
She's just started to get a little,
Yeah,
I know.
a little bit. I've kind of lured her in here on the belief that since it's a couple of months since the operation, it's time to check how her legs are healed.
Okay.
And if that pin is nice and stable. Cricket had a bad fracture that required a pin to essentially hold the bones in place. That pin's now been in there for a couple of months. So there is an opportunity today to potentially remove that pin if the pin has loosened or if the pin is just no longer necessary.
They're the same length, are they? Yeah, pretty much.
She's got a full range of movement there.
Yeah.
So I just think probably the best thing for her is to take an X-ray. Cricket certainly had a good recovery and a good rehabilitation, but she's still been a kitten and she's still been jumping all over the place and all over me. So there is some concern about how quickly and how properly her bones have healed.
The X-ray will show the metal pin in Cricket's leg and whether it has stayed in the correct position.
Yep, go. Pin actually looks all right. It kind of looks like a normal humerus with a pin inside it now. Yeah. The X-ray is showing two really interesting things. First of all, the bone itself has healed up brilliantly. You would not even know there was once a serious fracture there. But secondly, the pin is not an issue. It's sitting well inside the bone. In fact, the bone's grown up and over the top of it. So it doesn't need to be removed today. Look how cranky you are. What is it? It's almost like she knows what's coming next.
Well, they do have that extra sense, don't they?
While the X-ray shows she doesn't need one operation, there is no dodging the desexing today. That is going to happen, and I'm going to make sure of it.
Oh, you're a daddy's little girl, really, aren't you? Hey?
Daddy's trying to be strong, so
let's get on with it.
Hold the sympathy for half an hour.
I love you too, mate. Hold on, not long now.
At the Australian Reptile Park, General Manager Tim Faulkner also has his hands full with a little orphan Joey.
You ready for another Mothers Club meeting? Here's your bottle.
Cheers.
How's he going?
Yeah, he's good, eh? Still real sooky, right?
Yeah.
Tim and Senior Park Keeper Bill have started a daily mothers group.
No tongue.
After becoming full-time carers to two orphan Joeys.
You ready for some milk? There you go. Caring for orphan animals, and in this case, marsupials, kangaroos, 24-hour job. It doesn't stop. 6 feeds a day. In between, then you've got a toilet, clean up after. They're awake through the night. But a big part of that is giving them their bottles, their nourishment. He's a happy little roo. Is that his belly?
Yeah. He's shaking his
He's
bones.
chugging it.
9-month-old Reggie and 6-month-old Russell both lost their mums due to horrific circumstances. Without round-the-clock care, these little Joeys would have no chance of survival.
You've done a good job, mate, because he was a tough gig. Orphaned at such an old age, you used to get him much smaller. I can't believe you've turned him around to be your mate.
Yeah, he's the best, mate. Aren't you, mate?
In the wild, Joeys rely on milk from their mother for at least 12 months. Tim and Bill will need to keep feeding these babies until they're old enough to fend for themselves.
That's it, it's all gone. You want to come for a hop with Reggie? I know you're not going to like that, but it's time. Yeah. You're a good little fella. Come on, let's go for a hop. Red kangaroos are social. The way that we need to develop their skills, it even makes their body physically stronger, is to get them out into our park area. There you go, mate. There are other kangaroos that are adults, there are hazards, and there's, of course, people. But all of that teaches them and develops them to be independent roos. Do you want to have a pat? There you go. Yep. Do you know what sort of animal he is?
Kangaroo.
Yep. And do you know what sort of kangaroo? I'll give you a hint. See the colour there behind his ear? What is it?
A desert kangaroo.
A desert kangaroo or a red kangaroo, that's right.
It's a big day for Russell, as it's his first time being surrounded by a crowd.
Ready? Now you have to say, go Russell! Go on!
But Tim knows it's an important step for the little Joey to gain his independence.
They're great, as in little ambassadors. And we... He's cheeky. There's kids everywhere, and Russell's actually startling them. Not the other way, but he's getting used to the whole thing, and he's having a ball. You got him.
The budding little ambassadors are a big hit with park visitors. But now it's time for their all-important daily weigh-in.
Come on, mate. This way. I'm not coming back to pick you up. Come on, pal. That's it, boy. Let's go. Let's go.
This is your last chance, mate. OK, Chris is lovely as your dad, but he's way too young to be a granddad, you know?
Thank you, Neil. Good to see you on my side.
At the Bondi Clinic, Chris's parenting skills are being put to the test. 5-month-old Cricket is on heat, so Chris has brought her in to be desexed.
Going
Over and out.
lick your lips, yep. That's pretty good.
I guess the challenge here is not overcomplicating this surgery. It is very much a routine operation. It's a spay. It's an operation I've done thousands of times before, but somehow today it's different. And it's different because it's Cricket. She's my pet. So I found a uterus here, and certainly it's looking a little bit more inflamed, I guess, than it normally would be. They're the ovaries of a little kitten that's been on heat. You can see that they've got extra fluid in them, and they're really looking like they're busy. It's all grown up. What's that?
That can't be the ovary there, surely.
No, it's not, because the ovary's further up here.
It's a bit strange.
Looks like she's developed a fluid-filled lump just in the wall of her uterus. There is a chance that she's actually been able to feel this. It's not something she's been, I guess, able to communicate to me, and certainly she hasn't looked like she's been in pain at any stage, but to have a big cyst in the wall of the uterus, it's abnormal. In an animal so young, it's highly abnormal. But the fortunate thing is that today I can actually remove it. We may, through preventing an unwanted pregnancy, have actually prevented another disease from occurring, so that's a nice thing. Okay.
All
So
done?
there's the other half of the uterus there. Yep. So I'm happy with how that's looking. I'll just release it to make sure that bleeding's stopped, which it has. All right, we can start closing up.
OK.
Thankfully, what should have been a routine operation was just that. Everything's run smoothly. We obviously discovered the cyst in there, which was quite remarkable, but that's been removed. You waking up? Okay, come on. You ready to look at me? Not yet. Give me a stand. So now, it's full steam ahead to what should be a normal life. Well, normal, apart from the fact she lives with me. Good luck with that. Let me sleep it off.
Later that day, Chris has been called out to Double Bay near Bondi after an SOS from a concerned resident.
You know, Richard, eh?
Richard, yeah, and
hey,
Joey.
Hey, Joey.
Yeah, hi.
Good to see you. Yeah, I spoke to you on the phone there.
Yeah, a couple of locals.
Yeah.
And one of them, you can see, his name's Cassidy. Something wrong with his foot. I think we've noticed that it's probably up in its body.
How long have you noticed the limping for?
2 days. 2 days, yeah. I was sitting in the library, yes, and looking out the window and noticed these 2 ducks down on the lawn. Ushered Joey over and then noticed one moving of a distinct limp. So we thought we'd give you guys a call. Chris, Dr. Chris Brown, the Bondi Vet.
So what, everyone feeds these ducks here?
I think so, yeah. Yeah.
Yeah, they're part of the...
They're part of the local gang.
Even though I've been called out to help out a duck in trouble, when I first arrived, it looks like the opposite. These ducks are not in trouble, they are living the life. It is sort of this safe haven here with no dogs, but at the same time, at night,
yes,
when there's no one around, it's very easy for a dog to get in here, or even a cat or a fox. So, I mean, for them and for that particular duck, they're on the clock in a way because they have to be able to run away or fly away.
Yes.
Otherwise, rather than eating, they become the one eaten.
Ooh.
Do you just want to throw a little bit just here and we'll see if we can get quite close and have a closer look at that leg. Hey, look at this. Look at that. From about a metre away, I can see that Cassidy is definitely holding that leg in a different way. It's up on its toes. And he does that essentially to move the weight away from the problem areas. Working out exactly where those problem areas are is my challenge.
What do you notice about where he is right now? He's always staying an arm's length away.
Yes, he is.
And they're not stupid. They're great survivors, these guys.
Yeah.
And he knows he's fragile. He knows that he's vulnerable right now. And so he's not willing to risk anything happening to him. But we're going to have to catch him.
Yeah. And is there a technique?
You're potentially about to see a whole lot of them. The technique is you do a lot of this. And that's about it.
Yeah.
Righto. I'll take notes. You want away?
Oh, wait, just want to grab that diary.
At the Australian Reptile Park, it's weigh-in time for orphan Joey's Russell and Reggie.
Let's do Reggie first.
Tim and Bill have recently become surrogate mothers to the Joeys.
All right.
It's a full-time job, as these little bundles need round-the-clock care.
Joey's at Russell and Reggie's age are still totally dependent on mum. This is a full-on job. The only thing that gets more full-on is 2 Joeys at once. 6.7.
Yeah, awesome. That's 100 grams up, eh?
Yeah, that's great. All right, so 6.7 plus 100, you say?
Yeah.
Any discharge? What we do is take a weight, which is a really easy observation on general health. Did they put on weight or lose weight? And as well as that, we check for simple things like any signs of discharge, hydration, and just the general well-being of the Joeys. Ears are great. Eyes are good. I'm sorry, Reg. Don't get cranky, buddy. OK, so that's good. You want to just check his hydration, Bill?
Yeah, we're good.
Good as gold?
Yeah.
My favourite question of the day. How was he last night?
Do you want the short answer or the long answer?
Short answer for now.
Well, he had a party all night long, so he's very worn out.
Yeah, so he's happy?
He's happy.
I put Reggie happy, Billy not so happy. Bill and I love Reggie and Russell equally, but I do give him a bit of a hard time because Reggie was a bit older when he was orphaned. Now, that means he's a bit of a handful. He gives Bill a bit of stick. By stick, keeps him up all night, sometimes won't take his bottle, put him on the ground, he takes off. Russell is an angel. Yeah, 5.2. He's up 50. Just, that's not bad.
Yeah, nice.
That's all the milk he's getting, mate. He won't touch the solids. No surprises, the Joeys look great. Clean bill of health in all areas. You need to start on the solids, mate. Ears good, eyes good. I'll just check hydration while we're there. Forward, buddy.
With both Joeys given a clean bill of health, it's now home time, and that means Tim and Bill are heading off and taking the little Joeys with them.
Come on, Reg. That's it. Hold up, buddy. You better grab him, mate. Gee, you've got him well trained, Bill. Good boy, Russ.
I have the food.
Yeah, you're going to
I have the
food.
enticement.
Yeah.
Yes.
At Double Bay, Chris urgently needs to catch and treat Cassidy, the limping duck, before he becomes an easy meal for the neighbourhood cats and dogs.
Yeah, so at the moment, they're just resting underneath the tree, but the eyes are definitely on us.
Right. Yeah.
They're going to be suspicious.
Yes.
But they've never seen a net before.
Right.
And that's going to work to our advantage here.
Right.
OK, so what you need to do is get up there and be their best friend. We're going in with a simple strategy. Ideally, Richard will come in with the food first, distract them. They'll be so concerned about getting the food before the other one gets it, that then I can come around the back and grab Cassidy with the net.
Cassidy, Cassidy, Cassidy. We're sticking together.
You get the feeling they know what's going on? The closer I get to Cassidy, the further away he gets. He knows right now that he's vulnerable.
Come on, hop along.
See what I mean?
It does fly.
We've hit our first major hurdle. Catching any sort of wildlife is never straightforward, and you have to really learn from each failed attempt and put, I guess, the improved version into the next attempt. Just see something. Wind's blowing that way, so he's going to take off into the wind.
Yeah.
Right. So if we herd him with the wind,
Yes.
then he can't take off.
Right.
He's going to have to turn around and run at us
Yes.
to actually get off the ground.
Okay.
The thing you have to remember is that birds always take off into the wind. If we do everything now from the wind side and work upwind, then essentially he shouldn't be able to take off. Just come up a bit closer there, Joey. You can stop them from getting over that side.
Cassidy, come on. come on, hop along.
There we go.
Well done.
Hey, it's okay. It's okay.
Now I've finally captured Cassidy. It's a matter of working out what's going on here.
So everything's fine in there. No sign of any parasites. The gum colour's nice and pink.
Yeah.
Tongue's a good colour too, so we're confident everything's fine there. These feet, though, are intriguing.
When I look at the right leg, the good leg, it's interesting and unexpected because he actually has some quite serious sores on the webbing of that foot.
He's actually got infections
Yeah.
in the base of this other foot. So whether he's actually taken the weight on this foot and the problem's actually been in this foot all along, which would be quite strange, but...
To be honest right now, I'm confused and totally baffled because we knew he had one sore leg, but now, does he have two?
Hey, mate, hey, it's all right.
Hello, boys.
Tim has arrived home from the Australian Reptile Park with little orphan Joey Russell. And it's time for all the youngsters to have some fun.
Hey, baby, how are you?
Good. How are you?
Good.
Hello.
Come on. Hey, watch out for the little fella. Come on. What do you want to do? Let him have a hop? Come on.
Anything that you can possibly think of Australian animals, we've had it at home. Feather-tailed gliders, sugar gliders, koalas, kangaroos, wombats, Tassie devils and birds. Anything Australian, it's been here.
Whoa! Here he comes!
Hello!
Come here, Russ.
He'll bite you.
The boys are always a bit scary in the afternoons for him. He's had a nice quiet day. Come on, who wants to come and give his belly a tickle, please? You know, I never forget how lucky I am to be able to bring my kids up with wildlife. Being around it teaches them compassion, empathy, understanding, and they're better for it. Russell! Oh, Mum, we might need a towel.
But today, Russell isn't setting a very good example for Tim's boys.
He did a wee on the bench. Oh, no. Oh, Russell. Well, we may as well let him finish now, hey?
Oh yes, there's always a constant mess when the boys are around, especially with the animals that Tim brings home. He doesn't like to clean up after them at all. So that's my job.
Close your eyes.
But Tim's definitely in charge when it comes to bedtime.
I love you. Close your eyes.
Love you too, Moochie Boochie.
Okay, we'll leave Russell on the door. Russell will be with us for at least the next few months. But then he'll stay at work and we get a bit of relief. Here we go. Night, boys.
Night, Russell.
When he goes, I think the boys will miss him a lot. What I won't miss is the round-the-clock feeds. Love you, boys. I bet he'll be up through the middle of the night, but whether he is or he isn't doesn't matter, because tomorrow, back into it again.
He's actually got infections in the base of this other foot.
All right, yeah.
Which would be quite strange, but...
In Double Bay near Bondi, Chris is trying to work out what's wrong with a native duck called Cassidy.
So that's actually called bumblefoot, so they're foot infections.
Right.
Deep infections in the skin of his foot, and that's really dangerous.
Locals Richard and Joey first noticed Cassidy's severe limp 2 days ago.
So he's ripped it open in a sense with too much abrasion or
and bacteria have got in there
bacteria,
now.
Right.
Okay. This is completely unexpected. Remember, this is the good leg, yet he's got quite a serious problem on it. This now complicates the situation.
Have a look on the other side. So watch when I bend that up. Now I'm pushing quite hard.
Yeah.
We're still...
Yeah, it doesn't touch.
20 degrees, 30 degrees away from his foot touching his thigh.
Yeah.
Compared to this one, which with no effort at all, goes the whole way up.
Oh, you're a brave duck.
So Cassidy has a foot infection on his right foot and an ankle problem on his left leg. 2 problems, but I reckon there's one cause. Now, there's one thing that causes swelling like that and a lack of mobility in the ankles of ducks.
Right.
And it's something we normally see in older men that maybe drink a bit of beer.
Gout.
It's
gout.
Oh my word. You got gout, sport?
Oh no!
Speak to anyone that has gout and they say it is absolute agony. It's essentially a metabolic abnormality that affects people, it affects all sorts of animals, and it certainly affects ducks. What's happening is each time Cassidy eats food that contains protein and nitrogen, he tries to break that down, but he doesn't do it properly. As a result of his metabolic abnormality, he produces crystals. Those crystals are lodging in his ankle.
And Chris doesn't have to look far to find the cause.
See that right there? That's not a normal neck. That's actually a collection of all the food he's eaten in the last hour or so. And that is about that big. I mean, that's an entire day's worth of food for him, but he's eaten that in the last hour, just going around hassling people for food. Because Cassidy is such a guts, he's filling his body with all sorts of human food that contains protein that a duck normally doesn't have to break down. His body's struggling with it, so it makes sense that he's having so much trouble walking around on that left ankle of his.
Yeah, bless him.
I saw someone trying to feed him sushi before.
Yeah.
And for him to break down proteins which he normally doesn't eat, it causes him to produce all these extra waste products which produce the crystals which lodge in his joints. So in a way, he's a victim of his lifestyle.
A modern diet.
To fix gout, what you need to do is give Cassidy a tablet which helps to metabolise that protein and get rid of those waste products safely. So he's going to get two things. Something for the gout and an antibiotic for his foot. Cassidy is a cute little guy, but the fact is, with the diet that he has right now, he's not going to stay around for too much longer. So if we can change that, give him his medication, then hopefully Hopalong Cassidy will be Hopalong no more.
Well done, you.
Cassidy will need medication for another month, so Chris is enlisting the help of Joey and Richard to give him his tablets and keep an eye on his diet.
Here you go, little guy. Here you go and see her. Off you go. Here you go.
We can save Cassidy, I'm sure we can. I'm more than 100% sure. He needs to cut down on the rubbish tucker, and with Joey's and our involvement, Cassidy will be fine.
It's almost all over to you guys now.
Yeah. We'll monitor Cassidy and look after him and give him his tablets. Yeah.
So, today is the start of the rest of his life.
Excellent.
I'll be in touch though.
Okay, all right.
Good luck. Any problems, let me know.
Okay, all right.
Thank you.
Thanks.
A lot of people complain about cats needing exercise, but for you, it's never really a problem, is it?
In Bondi, it's been 2 weeks since little Cricket was desexed.
Always that little bit too far away, right?
But Chris's cheeky housemate isn't taking any time to rest and recuperate.
Normally an operation like desexing will slow a cat down for quite a few days, maybe even a week or so. For Cricket, not so much. In fact, if anything, over the last few weeks, she's kind of stepped it up a notch. Now you're growing up, we should really think about school. But what if the teacher gets out a laser pointer? Is this going to happen? Instead of chasing male cats, she now chases lasers and balls all day in, day out. I always knew that Cricket was a bit different. It's kind of the reason why I adopted her in the first place. I never really realised just how different she'd be. A lot of people think cats are independent. Cricket is not one of those cats. She's needy. This is what I mean. Just always has to be there. Centre of attention. We're going to have an interesting life together. Hello again.
Hi, Chris.
How you going?
Good. Welcome back to Cairns.
It's good to be back.
Great.
What have you got lined up for me this time?
Well, I hope we've got some good cases for you.
Always have. Just
Go
that
on out the back.
special one.
Yes.
Chris is at the Marlin Coast Veterinary Hospital in far north Queensland. He's lending a hand at the busy clinic, which looks after both native and domestic animals. But there's no time for the visiting vet to settle in.
How you doing? With Danny, isn't it?
Yes.
Yeah, I'm Chris. How are you?
Good, thanks.
Is the dog that got a bit close to the trimmer? Come on through.
It's trimmer, I should say. Come on.
Danny, the clinic's gardener, has brought in his dog Misty after a freak accident at home.
So what happened?
I was just shooting up my hedge trimmer.
Yeah.
Just on the hedge, and she just ran in and snapped at it, sort of thing, and just bit the bottom of the blade.
Oh, God.
And then she,
Yeah, wow.
I thought to begin with I chopped a nose off or cut her lips open, sort of thing, the amount of blood that was everywhere.
That blade has cut right across her nose there. Yeah, it's got blood in her mouth too.
Well, there could be a tongue could have caught it as well.
Yeah. Misty looks quite stressed, but also around her mouth you can see a lot of blood. The first challenge is going to be working out exactly where this blood's coming from. The first check is inside her mouth, especially around her tongue. When a dog lunges, sometimes the tongue will come out. If that's happened, it could have been cut off.
Fortunately, Misty's tongue looks to be intact, but Chris is still worried about the deep cut to her nose.
It's obviously gone through that top layer, which is quite thick, and then down into the tissue underneath. Really, if she'd gone a half a centimetre further on, that would have taken her nose off. The problem we've got is that it's quite an open wound, and it's still spreading out. And as it swells, since the injury is quite recent, it will actually push those wound edges further apart. I really think the only option for her is to actually stitch that nose.
Okay.
If she continues to lick at it, then those wound edges aren't going to come together as we need them to. So the simple fact is, what she needs is an anaesthetic and stitches. Okay, so if you don't mind, I'll take it from you now. Cheers.
So they might put him to sleep and then take the hook out.
Trinette and her daughters Maya and Amy have arrived at the Bondi Referral Hospital SASH with a distressed bird they've named Colin.
We were going to Main Cove River Park for a bit of afternoon activities, but we found a bird stuck in the reeds. So we investigated and discovered that he had a hook and fishing lines attached to him and to the reeds, so he couldn't get away.
Trinette and her family of committed rescuers managed to capture Colin. They're now hoping that emergency vet Dr. Claire Boland can help the injured cormorant.
Hi, how are you? I'm Claire. What do you have down here?
Cormorant, we found it at Main Cove River Park.
Oh, great. Let's bring him in and we'll have a look. Come through this way. Okay. Oh, yeah, isn't he beautiful?
Yep.
But he's got a hook hanging out.
But you can see it, can't you?
Yeah.
So not very happy.
No. I can see a fish hook stuck in his feathers, in his chest, just near his wing. He looks cold, he's wet, he's shivering. I don't know what damage that fish hook's done yet. Hello. Okay, I can see that fishing line. Have a look under here at the hook. Look how big that is. If this hook was left in there, it's going to cause a nasty infection and he'll get really, really sick. Okay. This little guy has been so lucky to be found by Trinette and the girls when he was. If he spent another night out there, I don't know if he would have survived.
Claire is also worried that the hook may have punctured the cormorant's vital organs or even broken his bones.
That's a good bird, hey?
A full examination is needed to determine if Colin has any other potentially life-threatening injuries.
He's probably been flapping around quite a bit on the end of the fishing line, so he could have some trauma. At this stage, I haven't found any other injuries. He's holding his wings in the right position, he's using his feet, and he looks fairly bright and responsive. So our next step, we'll take him through and give him an anaesthetic, take an X-ray of him, assess him to see if he's eaten any further hooks. Well, good job. They're pretty hard to catch.
Yeah, and it was very muddy, very slippery.
Yeah, we'll take him through and get him assessed. Okay, take some X-rays and see what we find.
Fantastic.
All right, great. The worst case for this little cormorant is if it has damaged his flight muscles, broken a bone, or punctured into his internal cavities like his chest or his lungs. He could get a really serious infection, and I don't know if we'll be able to save him if that's happened.
Have you ever seen this before? A dog that's tried to attack an edge trimmer?
No, I haven't actually. So there's a first time for everything.
Yeah.
At the Marlin Coast Veterinary Hospital in Cairns, Chris is anaesthetising Misty.
Good girl.
The naughty Border Collie seriously injured her nose on a hedge trimmer.
So now Misty is anaesthetised. It's time to get her through to surgery and try to correct all the damage that hedge trimmer did. Okay, here we go. From what I can see right now, it seems like the entire left side of the nostril needs to be put back together and just a small section of the right. We should be looking at around 4 stitches to really bring this together. Whew.
But almost straight away, what Chris believed to be a relatively straightforward procedure has suddenly become a lot more complicated.
You can see now as I'm putting these sutures through just how deep that wound is. Wow, so that's going a lot further back than we thought. See, that's extending right into the back of the nose. We're going deep into the nostril there. So it's clearly one blade has come across, just clipped here and cut right into the side of the nose there, then continued on and cut through there. So, whew. You can see just how close to absolute disaster Misty has come here.
Misty will now need even more stitches in her lacerated nose.
This is a very small and a very sensitive area. So if I'm in any way off with my sutures, it will actually pull the nose off to one side. That's obviously not what we want here.
All right, it's pretty good.
The left side has actually come together pretty well, but now it's onto the right side.
The challenge here is that we're now so far up this nostril here that I really can't see where the suture's been placed. You're really going more on feel. We're now 7 stitches in, and that really gives you a good measure of the fact that without stitches, this just would not have closed up. All right, well, 1, 2, 3, 4, 5, 6, 7, 8, 9 stitches later, we're done.
Finally, Misty's nose job is finished and the Border Collie can be taken off anaesthetic.
All Misty needs to do now is to sleep off the anaesthetic, and soon enough, Danny will be here to take her home. You rest up.
Hi, Serena.
Hi.
Guess what I've got?
What is this?
A cormorant.
Oh, wow.
At SASH, little Colin is in serious trouble.
He's got a big fish hook stuck on his chest.
Oh my God, he has too.
Yeah.
Okay.
Emergency vet Dr. Claire Boland is hoping X-rays will confirm whether the hook has caused any serious internal injuries.
All right, buddy.
But first, Colin needs to be anaesthetised, and it's incredibly risky.
Pop your head in there, sweetie. We can't keep this little cormorant asleep for too long. He can build up anaesthetic in his system and they can stop breathing and even die. Big deep breaths, buddy. Big deep breaths.
Go to sleep, Colin.
We have to get the procedures done as quickly as possible. Okay, that's good. He's finally asleep. I want to make sure the fish hook in his skin hasn't done any damage to his bones. Okay. Ah, there he is. It's good news on his x-ray. It looks like the fish hook's just in the skin or maybe the muscle, but it doesn't look like it's damaged anything internally, and I don't see any fish hooks in his stomach.
But the little bird isn't out of danger yet. The fish hook needs to be removed urgently, and it will be a delicate procedure.
We'll just get him to go back to sleep and then we'll try and take this hook out, okay, Serena? Okay. I don't want to cause any further damage to his skin or his muscles, and I don't want to leave any little bits behind. That could cause a really nasty infection.
You happy with how that looks and feels? Shall we go and cut the small talk? All right, let's go.
At the Marlin Coast Veterinary Hospital, Danny is waiting for his little mate, Misty.
Good, he's the boss.
The naughty Border Collie attacked a hedge trimmer and needed surgery to repair her nose.
Excited to pick her up. Hopefully she's all better now. Hopefully Chris has done the trick.
How are you, Dad?
Good, thanks. Misty.
Well, the tail's wagging. It's a good sign.
You still in one piece?
Yep. What do you reckon?
Oh, well, you can't even see them.
So it took 9 stitches.
9 stitches?
Yeah.
Oh, my God.
And right on the inside of this right nostril, it was cut about 1 centimetre back. So on the side that didn't look too badly affected, that was actually where most of the damage was.
Misty is very neat. You could hardly see the stitches, but it's amazing that Chris was able to stitch it all up. I'm hoping now that Misty will stay away from my tools when I'm using them and sit back and watch instead of chasing them and biting at them. Thanks
Well, it
very
looks
much.
that she's keen to get going.
Oh, yes.
All the best, Dan.
Yeah, greatly appreciate it.
Yeah, no worries, buddy. I'm going to say I'm happy and even a little bit relieved that Danny thinks I've done a good nose job on Misty. And hopefully for Misty's sake, she's got a few days off the job from now on. This part of North Queensland is renowned for having some pretty fast and some pretty deadly wildlife, but the animal I'm about to go and see is one of the slowest creatures around, but it's that speed that may have just got him into trouble.
Later that day, Chris is answering an emergency call-out for an unusual hit-run victim.
Who is it, boys?
Hello? Are you the turtle I come about?
Hello,
No?
how are you?
I'm Chris.
Christy, lovely
Nice
to meet
Chrissy.
you.
Hey guys.
Say hello, this is Xavier and Tane.
Okay, nice to meet you.
Thank you so much for coming. We've
That's
got
all
a
right.
sick turtle.
Yeah, where is he?
Just through here.
All right.
Christy is concerned about an injured turtle she found on the side of a busy local road.
He was almost getting hit by the other cars passing by, so we got out of the car, we picked him up and we saw that he'd had a big crack underneath, so we brought him home and called Mullen Coast. This is Donatello.
Donatello. Who named him Donatello? Where did you find him?
He was just on the side of the road.
I might get him out and have a look at him. He is a big turtle. He's a lot bigger than we get back home.
Really?
Yeah, you bet.
We breed them big up here.
It's a monster. Guys, could you just grab my little box there?
Good boy.
Thank you. The first thing Christy noticed when she picked up this turtle is that it has a crack. Sometimes the crack in the shell can only be a hint as to what's occurring beneath the shell. So my worry is that if the car's hit this guy hard enough, then it may have actually ruptured those internal organs. We could be looking at a pneumothorax, so a punctured lung, or even more serious internal injuries. Because that is a big crack right there. When you look at where the injuries are at the front of the shell, underneath, and also the chip here, it's safe to assume that when it was hit by a car, the car hit the front half.
Yeah.
What I find amazing though is with this neck being so long, how the head hasn't got any injuries.
Yeah.
Because as you can see, he finds it incredibly hard to tuck all of that neck and head inside the shell. So he's either been incredibly lucky or there are injuries that we just haven't seen yet. We'll just check out the rest of him for any other injuries.
So it is a boy?
Well, that's what I was going to look at.
Is that a tail or?
It's a tail, but would you call him Donatello?
Oh.
You okay with Donna?
It's a girl.
It's a girl.
It's a girl.
Look, I'm quite keen to take her back to the clinic and X-ray her to see whether she has any other serious injuries.
Yeah.
So we're going to take her now and go and patch her up.
And when you finish, can you take her back here? And then we put her back where we found her, but not on the road.
Yeah, we'll definitely let you know when she's all fixed up. Even though we've cleared up a few mysteries, like the fact that he is actually a she, there are still quite a few unknowns here. We truly won't know the extent of Donna's injuries until we get back to the clinic. An X-ray will give us a really clear view about what's happening underneath that shell. And once we do that, we'll be able to plan out what sort of future she has. Okay, guys. We'll talk to you soon.
Thanks.
Thanks again.
See you later, Chris.
Bye-bye.
Bye-bye. Thank you.
Hopefully the hook comes out easily. I don't know how far that's stuck in.
At SASH, emergency vet Dr. Claire Boland is about to try to remove the fishhook, which is lodged in Colin's abdomen.
Oh wow, yeah. It's quite red and swollen.
Claire will need to work fast.
Keep breathing, little buddy. That's all we want. cormorants are not good under anaesthetic. They're used to diving deep under the water and they can hold their breath for a very long time.
It will be vet nurse Serena's job to closely monitor Colin's breathing and heart rate throughout the procedure.
How is he, Serena?
Yeah, he's fine.
He's good?
Yep.
So I'm going to try and remove this hook. I'm going to cut off the end with some pliers and then feed it through, pulling it out barb first so that I don't tear his skin. It's all right, little buddy. It's almost through.
Oh, wow.
There.
That's a very big hook.
Look how big that is. It's got a big barb on there. If we had have pulled that through the other way, that would have done a lot of damage.
Yeah.
Okay. We'll give that a clean off with some alcohol. And then we'll glue you back together, little bird.
A surgical strength tissue glue will be used instead of stitches to close up the 2 wounds left by the hook.
Okay.
Excellent.
I'm going to give him some antibiotics, pain relief and warm fluids before he wakes up. Okay, so we've finished his fluids. Let's turn his anaesthetic off and wake him up. Now, this is the real test where I like to see him breathe.
Colin has now been anaesthetised for more than 30 minutes, so it's important that the little bird wakes up as quickly as possible.
Come on, little buddy. Come on, Colin. It's all finished. The hook's gone. His procedure's all finished and now I'm waking him up. At the moment, he's not really taking any breaths. I can't tell if he's just holding his breath because he's a seabird or if he's actually stopped breathing because of the anaesthetic. Wake up, buddy. Big, deep breaths. Let's try him without his mask for a minute, Serena. So his eyes are starting to open. Oh, almost. He's moving. Hello.
Hey, buddy.
You're back again. He's breathing again. I'm really happy. In your hot, bud.
Colin is still a bit groggy from the anaesthetic, and he'll have to be closely monitored overnight in case of any side effects.
It's all finished, buddy.
She's got a big crack right across the middle there.
Poor darling.
So I might x-ray her straight away.
Yep.
In Cairns, Chris has arrived back at the Marlin Coast Veterinary Hospital with Donna.
Yeah, it's a nasty wound.
The long-necked turtle is in a bad way after being run over by a car.
Now we've made it back to the clinic, the reality dawns on me. This is where we have to try to fix this shell. And the more I look at it, the more I realise it's going to be one hell of a task.
Do you have a box? I just need to find a way of positioning her on the x-ray. So I want to get a view straight through the side of a shell.
Yeah,
Got any old cardboard boxes or polystyrene boxes? I think I've got an idea. What do you reckon?
Let's give it a go.
Okay.
With vet nurse Crystal giving the tick of approval, Chris is now ready to put his unusual invention to the test.
It's pretty good. You're not happy, are you? And deservedly so, but at least you can actually look me in the eyes and express your displeasure about this situation. All right, I'll make this quick.
There's no doubt in my mind that not fixing Donna's shell is simply not an option. With an open shell like this, bacteria can just go straight inside the body, and from there, we're talking about a serious infection that could very well be fatal.
Okay, she's pretty settled now. Okay, ready to go?
Yep. Cool.
You were very good. That neck just goes everywhere, doesn't it? Okay, we just need one more shot here. This might actually be the hardest one of all. Just straight on.
Turtles obviously look like very unique creatures, and they certainly are. But you have to remember those bony plates that make up the shell are really there to protect the internal organs. Once you go through the shell, chances are there's something significant sitting underneath it.
The fact is, in order to fully assess how serious Donna's injuries are, we need two views, one on the side and one from above. We've now taken those, so it's time to see the results. Didn't expect that.
How you going, Sam?
Yeah, I'm all right.
Good, mate. I'm Steve. How are you?
Today, Specialist Surgeon Dr. Steve Fernside is working away from SASH. He's volunteering with a very important community clinic.
Well, I'm here today with Pets in the Park, which is great. It's a charity that helps support homeless people and their pets. So we're going to have a look over a few pets today and meet their owners, which is wonderful.
His first patient is 3-year-old Ty and his owner Sam.
I'm just worried about a pressure sore that he's got on his back foot.
Yeah, let's have a look. Which leg?
Right rear.
Right rear. All right.
It's all pussy.
Yeah, you might need a bit of treatment, that one, because that's actually open. And it's not too bad at the moment, but it could get a bit nasty. Okay. When you first look at Ty, you can see he's got some of these skin lesions that are signs that he's been living life reasonably hard. His bed most of the time is a concrete floor, and he's starting to get those abrasive type lesions over his pressure points, which if they get bad can become ulcerated and infected, and that can be a serious problem for this dog. We'll give you some antibiotic lotion for that, and that'll just keep it a little bit cleaner and help you maintain it while that callus forms over that spot. So it'll take the sting out of it, and it'll just help make it a bit more comfortable while it heals over, all right?
Basic medical treatment for animals can cost hundreds of dollars, but the team from Pets in the Park perform essential procedures free of charge.
For people who live on the street or live pretty hard lives, dogs are fantastic. They're always there for you, they're always happy to see you, never give you a hard time. So for those people, they are an essential part of their life. So if you could show everybody in Sydney how that dog looks, that's how a dog's supposed to look. Pretty fit, pretty slim. So whatever you're doing the right thing, mate. Looks great.
Thanks a lot. Whenever there's something wrong with him, whether, you know what I mean, it's something small or something major, yeah, I worry about him just like you do your children. So, yeah, it's nice to know that I'm doing the right thing.
In Cairns, Chris is anxiously awaiting the results of Donna's x-rays. The long-necked turtle has been run over by a car, and Chris is worried she may have serious internal injuries.
There are really a few important parts of this x-ray. First of all, we want to see the initial injury we knew was already there, this crack in the base of the shell, and that's certainly showing that whilst it's there, it's not penetrating into any body cavities, which is really good news, but also it's allowing us to see the rest of the shell and see that there are no other cracks, there's no other damage that's been caused by the car. Although the first shot is good news, it's the second x-ray that holds most of the concern for me, because it'll reveal whether any organs have been damaged and whether any infection has taken hold. It's a very different view, but what it does show as well is that this head and neck, it really does protrude out the outside of the shell, and I'm still amazed that it hasn't been run over, because by the looks of it, there are no fractures through this neck region here. All the feet and leg bones are intact and fine, right down to these back legs. They're incredible creatures because they have almost all the same bones that we have, only they look so completely different. It's just all kept within this shell that's meant to provide that safety barrier for them.
Donna's shell has saved her life, but it's come at a cost.
I've never treated a freshwater turtle this big and never had to deal with a fracture in a shell this large. My concern right now is that maybe there is no way of fixing this injury. First of all, we have to lever it back into place, but then we need to work out a way to actually keep it in place, bearing in mind that we've got an animal that's going to rely on the shell for protection. Fixing turtle shells like that, it's never easy, and right now I'm not even sure how we do fix it. The tricky thing here is that you've got quite a thick shell that's fractured the whole way through, and the x-ray proves it. They are incredibly hard to fix, and right now, I'm not even sure we can fix it. If we can't fix this shell, then Donna will never be able to go back to the wild, and infection will be a constant concern for her. There is something that I've seen done before, which might work.
Yeah. Is it a bit of a gamble?
It is, but I might need some of the other nurses' help. So you guys don't happen to have spare bra clips? I'm being serious.
Well, I could take mine off.
Sorry, that wasn't a request. Quite seriously, there is something I can do with bra clips. You left. Is there a shop that would have something like that? Like the clips that attach the bra at the back?
It's just one down the road at the shopping centre.
Yeah? Okay, is that going to be the safer option here?
Yeah.
All right, I'm going to leave now. I'm not sure if bra hooks have ever been used to fix a turtle's shell before. I'm guessing not, though. Hi there.
Hi.
Hey, I have a rather interesting request.
Yeah?
I'm looking for some bra clips.
Some bra clips.
Not for me.
Yeah?
I've got all the support I need, but it's for a turtle.
A turtle?
Yeah.
Oh, cool.
Yeah. Do you have any little clips that I can sort of put over a crack in a shell and kind of tie some wire around? Just little metal clips is what I'm looking for.
Yes, I think I know what you're talking about. How about if we go that way?
Yeah, okay.
It's not every day you get somebody coming in, especially a vet, looking for a bra clip. I think something like this, because you've got so much of a backing on it, that would probably glue better. And then, if you
what
turn
are they
it... These are for your pants. So you hook them around, and see the hook in there? So you might be able to hook it around, just like doing up the wedding dress, that one.
I've got a lot of experience with that.
Exactly, yes. You come in looking for a bra clip. I think he's got a one-track mind, but he's all sorted out now. I've sold him something else, hunky-dory. Our little turtle's going to be fine from now on.
All right, thank you very much.
OK, see ya. Have a good one.
Yeah, we'll do.
See you next time.
Of course. There'll be a next time.
Bye.
See you later.
So Ashley, has he always limped since you've had him the whole time?
Oh, it happened at about, I think, maybe about 3 months.
Yeah, OK.
Dr. Steve Fernside is examining Thor as a part of a clinic called Pets in the Park, a free veterinary service for Sydney's homeless community.
Let's have a feel of these knees. When you actually manipulate, you can actually click his knee in and out of the groove. And when you click it out, he holds his leg up in the air. And then when we put it back in, he'll actually put it down again. And what that's called is a luxating patella. The patella is the kneecap. And what happens is it's supposed to sit in a little groove in their knee, and when the little kneecap slips out of the knee, not only does it hurt, but the knee becomes a little bit unstable. Thor's got a very common condition we see in little dogs. It's a difficult condition because sometimes it can cause quite serious debilitation. Often we need to operate, and we need to manage arthritis as well.
But surgery isn't an option for Ashley. However, with the help of the Pets in the Park program, Thor will receive injections to help manage any pain.
I just feel so much better. And to know he's going to be okay, it's a big relief.
Steve's next patient is Thor's brother, Dodge.
We might give these ears a clean. There is a bit of wax down there, and if that builds up too much, they can get a bit grotty and smelly. All right, Sport. There you go, a little bit of liquid down there. We give it a bit of a massage just to work the wax and loosen the wax up a bit. All right, we'll give it a bit of a wipe over. There you go, Sport. There's not too much wrong with Dodge, to be honest. He's as solid as a truck. And I think Ashley does a really good job of keeping Dodge in top nick, which is great. What about me?
It's a relief for Ashley that her two best mates are healthy.
He gets a bit lonely out here, so to have a dog just makes it so much easier. They're your best friends. They're everything. And to have these guys doing that is just great. Thank you, guys. Thank you.
Very welcome.
Come on, guys.
Good luck with him.
See ya. Thank you.
Look, it's been great because we've been able to meet some people who care for their dogs as much as I care for mine. And it's nice to be able to help them out in a little way to help them give some health advice to help their dogs' lives, to make it a little bit easier.
Good news, guys.
Oh, yay! Bra straps are everyone.
Well, funnily enough, not. Went for a more masculine option of trouser hooks.
Trouser hooks.
Yep. So, I'm ready to go.
Yep.
So we might get Donna set up for surgery and...
Yep, let's get her on the table.
Get going.
In Cairns, Chris is ready to begin surgery to repair Donna's shattered shell.
Can I get you to hold her there?
Yep.
If the shell isn't fixed, Donna runs the risk of developing a life-threatening infection.
The challenge we've got in repairing this shell is the fact that it's living tissue. It has a blood supply, so we're actually pulling some of it back just so we can get those ends of the crack together. It's not easy, and it can be quite traumatic. The helpful thing here is that by putting a neck like that, it should show off a jugular vein.
At the moment, because we're dealing with a creature we don't routinely see that has an injury that is quite rare, we're having to go to extraordinary lengths to come up with a solution.
Just stick your finger in his mouth just to see if he's asleep yet.
After you.
These jaws are incredibly powerful, so if I can avoid losing a finger, it'd be ideal. Sound. She's a real challenge. I mean, you're dealing with a patient that takes up to 10 minutes to fall asleep from her anaesthetic. And from there, she's still got the ability to chomp down. So we're having to be very careful, but also really plan out every move. Okay, let's get this in here.
Donna is finally anaesthetised, but suddenly there's a problem.
She was breathing every 4 seconds. It's starting to slow. And I'm probably going to have to start breathing for her now.
There's just a bit of concern at the moment because we're not seeing any signs of life out of her. These guys are renowned for not really giving too much away. Their pulse rate's incredibly low, respiratory rate's incredibly low under anaesthetic, but we can't get any sign of life out of her at the moment. She's gone from biting my finger to all of a sudden being incredibly deep, to the point where we can't see any breaths, we can't really get any sort of pulse rate, we can't hear a heartbeat.
You happy for me to give her a breath?
Yeah, give her. Oh. It's alive. It's bit me on the finger.
Okay.
Being bitten on the finger by a turtle is normally something I dread, but I've never been happier for it to happen. Now it means I can finally get on with fixing Donna's shell.
You can see just how much that's overriding. This needs to shift all the way up there, but the problem is it's now not going back into place. So we have to take some of that off, and then hopefully the forces will relax. We can actually slide those two plates together. If you clean her up, I'll get started on this and we'll just move quickly.
Yeah.
The equipment we have to use is essentially equipment we normally use for orthopaedic surgery, where you are operating on bones, so it helps, but it still makes it very slow progress.
The whole point of cleaning these edges are all about making sure we minimise the chance of infection, but also we give ourselves the best chance of getting a strong bond.
We're still overriding quite a bit there, so I may just try to take a bit off the end here. So I've decided to take a bit more of a dramatic approach, because if I just continue to sand back that shell, we're just never going to get to the point where we're getting these ends of the shell to meet. But with these ronges, which are essentially bone cutters, we're able to really get to a good point where it's looking like the shell's starting to align. Okay. It's starting to look more like it.
Yeah, that looks good.
Really part of the battle here has been trying to get this crack back to really healthy tissue where there's nothing dead and there's nothing where it shouldn't be. So now I'm pretty happy we're in that place. So it's time to get some gloves on, get started.
Hi Susie, I'm Claire.
Hi, nice to meet you.
Come through, I've got a little cormorant to give you.
Oh, great.
Okay.
At SASH, it's time for Colin the cormorant to be taken into care with animal rescue group Wires.
We get a lot of calls at Wires for seabirds with fish hooks, but they are normally so hard to catch because they can normally still fly. Luckily, some people caught this one and it's been brought in and able to be saved.
Hello. Whoa, certainly a lot more energetic tonight. Just wrap up his wings there. Pop your little head out. Oh, isn't he beautiful? Okay, Susie, would you be able to just put a gentle hand on here, hold his wings down?
Certainly.
So I'm just looking for a little loose piece of skin at the top of his leg. That's perfect, Susie, thank you. Nice warm fluids with a little bit of glucose just to help him on his way. All done. What a good patient.
So I'm going to take the cormorant into care for a couple of days, see how it goes with feeding. As long as it's eating well, it can be safe to be released.
Great, so I'll hand him over to you now. He's in your care and hopefully he'll be back out in the wild pretty soon.
Yeah, it shouldn't be too long.
Great. It's not every day I get to see a cormorant, and Colin has just been the best little patient. I'm a little bit sad to see him go, but I'm really happy that he'll be back out in the wild soon.
I'll open it up and you can just have it.
In Cairns, surgery to fix Donna's shattered shell is underway.
The way we're actually going to attach these metal clips is kind of the same way as you attach braces to teeth. We'll form a resin that goes directly on and really bonds the shell to the metal of the clip. Weirdly getting flashbacks to when I had braces. They're not happy memories. Be really careful to leave what is the crack and essentially the open wound here very clear of anything, because that's living tissue. That has to heal. It's going to form a scab and then a scar. So we're going to run some wire between them all, but we're still dealing with some big forces that are going to try to pull this down. So what I'm thinking is using an oversized paddle pop stick or a tongue depressor, we're going to glue that in place, and that's going to be a really supportive brace just to counteract those forces. Make sure we get the angle right here. The wood as a material is perfect because it has a little bit of give, and you want some flexibility just like the natural shell does. This has really become one of the most bizarre surgeries I've ever done.
With everything in place,
okay, that's a good start.
Chris can now start the final stage of the reconstruction.
So we're using a figure 8 pattern to balance out the forces and make sure that it's pulling in a really parallel way. So once the wire's in place, it's just a simple matter of twisting it to tighten it, and naturally we'll actually apply that tension across that wire. And it's that tension that's going that direction that's actually going to bring the shell back together.
After 90 minutes, Donna's surgery is finally finished.
All right. So looking at it, we've got a good supportive structure across the top here, but now between these clips, it's really bringing those edges back in together nicely. There's no overriding. Everything's looking like it's pointing in the right direction. All right. We can wake her up.
Yeah, looks great.
The nature of turtle shells means that this won't be a quick recovery. It's going to take weeks and months for that shell to get its strength back. But thankfully here, in this vet clinic, she's in safe hands. She just needs to learn to live a slower pace of life. All right, so this is your temporary home. Once you're all healed up, you know what you can do? You can use those snapping jaws as much as you like. The team here at Marlin Coast will look after Donna for the next few months, and then those clips will be removed, and then she'll go back to the wild.